Hepatitis C is a major issue for San Francisco. We think we have about 12,000 people who are living with active virus in their bodies. And when we think about who those people are, we know that the majority have a history of injection drug use, but we also see a lot of representation in other vulnerable groups, including men who have sex with men, homeless populations, and people of color. The big event was in 2014. We had the tools now finally to get rid of hepatitis C in pretty much everybody. So the advent of all oral therapy that was really well tolerated really changed the game and made this feel possible.
Another really negative misconception is that a person with an active drug use disorder can't adhere to daily medication. And we have completely disproven that. So many of the people that we have treated, again, close to 200 people, many of them are still injecting drugs. And we have shown that they have cure rates that are greater than 95%, which is equivalent to people that are not injecting drugs.
You know, in working towards getting people help if they choose to cut down on their drug or alcohol use or into recovery programs, they may not be there with that. And sometimes treating the Hep C will tip them over into accessing treatment they otherwise wouldn't.
And I've seen them not only progress with and complete their hepatitis treatment and become Hep C free, but also educate their communities. They've established a place of residency where they're living and also established care and primary care after knowing that they can accomplish something and follow through.
So in working with marginalized populations, if they elect not to come to us in a four-walled clinic to receive treatment, then we will bring the treatment to them. And I think that's an integral part of how this collaborative is going to be successful.
Come up with ways to do it from a van, come up with ways to do it, where people are living in multiple spots throughout the city to make it easily accessible. Start providing medication lockers for our marginally housed communities so they can store meds, they don't have to have them stolen every night, and increases their chances of successfully being cured. If we keep doing these traditional models of barriers and limitations, we're never going to get to end Hep C.
The harm reduction piece is completely critical to hepatitis C treatment. You can't really separate them. So if you're able to cure someone of hepatitis C who's actively using injection drugs and they're potentially sharing equipment with someone else, that might prevent the next person from getting hepatitis C. But if you couple the message of we're going to get you treated and you also need to use clean equipment, that will further just make the hepatitis C virus sort of less likely to spread, really get good control of the public health problem that it exists today.
We've been part of an effort to really encourage primary care doctors to treat, and we find overwhelmingly that they tell us it's one of the most satisfying parts of their job. So primary care providers, including nurse practitioners, physician's assistants, can do a terrific job of treating, and it's really worth getting that skill set if they're seeing a lot of patients who are living with hepatitis C.
So I teach resident doctors and medical students, and sometimes they rotate with me in the Hep C treatment clinic. And I tell them this is like the happy business, because people are so excited to actually being considered for treatment. They can't believe that it's actually going to happen, and then it happens, and then they get cured.
Treating Hep C has been a phenomenal piece of my clinical practice. It can really transform people's lives, and there's really something special about that for someone you have a relationship with, to really take something that was a chronic disease that was a big worry for them and stress completely away.
I would love us to start thinking about Hep C just like we think about any other disease, diabetes, asthma, where it's a condition that we prioritize diagnosing, that we don't stigmatize people for how they got it or why they got it, and that we say, you've got this problem and we know how to handle it and we're going to get you treated and cured.